Good morning, ladies and gentlemen. I am Agilan, joined with
Mohammed Ahmed.
and you're watching CBN News. Today, we'll be discussing the topic of COVID-19 on the impact of different industries. COVID-19 is a term that everyone is familiar with and will remember it for as long as they live, as it affected us not as individuals, but as people all around the globe in more than one way. COVID originated from China, and even though the Chinese government did its best to stop the spread of the virus, ultimately they couldn't. And it spread throughout the globe and affected over 1.5 million people in more than 190 countries around the world. The countries with the highest cases reported were India, France, Germany, and the United States of America, who suffered the most with over 100 million cases and 1 million deaths, which is 2 times more than India, who comes in second with the most cases and deaths reported related to COVID-19.
But what we're here to discuss is how COVID-19's after effects still linger around and can be observed in the world around us in different sectors of society. For example, in business, food industry, travel, tourism, education, and obviously healthcare. Now, most people believe these after effects to be harmful and negative. That may be the case, but there are many positive effects that COVID-19 has left us with in different sectors of society, which we will discuss the two phases of COVID-19 and how it still affects us till this day.
Coronavirus, or more commonly known as COVID-19, is a disease caused by SARS-CoV-2 virus. Most people infected with this disease experience mild to moderate respiratory illness and recover without requiring any special treatment. However, older individuals with underlying previous health conditions are more vulnerable to develop extreme symptoms. The transmission happens when an individual who's already infected coughs or sneezes, releasing liquid particles which in turn infect another person that they might come in contact with, therefore spreading the disease.
One of the main reasons of the spread of this disease to a global scale was lack of information. When this virus first started showing up around the world, it was treated as a simple cold or flu and was ignored completely, since we hadn't seen such a disease before, and thus it was ignored for a great period of time. Because of its elusive nature, it showed signs of infection 4 to 7 days after the person had already been affected. Thus, people unknowingly transmitted the disease since they themselves weren't aware of it. But this isn't the only reason. One of the major reasons is that the disease wasn't taken seriously by the leaders around the world and was dismissed as a simple flu like many others. It's a hoax. There is no coronavirus, which was famously said by Donald Trump in 2020 during one of his speeches.
Now the Democrats are politicizing the coronavirus. And this is their new hoax.
Which led whole of America to believe him and not take any precautions in the early stages of the virus. Thus, it spread like a wildfire.
Since this was a disease that no one has ever heard or seen before, it could be treated as well, and thus after everyone had realized that what we are dealing with is indeed real and dangerous, the research on this disease began. In mid of 2020, there were ongoing tests on the vaccines that were starting to emerge, which were conducted on a small scale at first during the end of 2020. The FDA, or also known as the Food and Drug Administration, officially approved its first vaccine, Pfizer BioNTech COVID-19, on December 11th, and a week later, Moderna vaccine was also approved. A vaccine for animals was also made by the Russian government during the same period of time.
The COVID-19 pandemic has had significant impacts on people's mental and physical health. The sudden changes in daily life, such as isolation, economic uncertainty, and the loss of loved ones, have caused high levels of stress, anxiety, depression. And additionally, the constant news of pandemic and its effects can lead to feelings of hopelessness and fear.
Coronavirus.
There are fears a rapidly spreading virus has reached Australia.
This is a rapidly emerging situation where there is not a cause for alarm.
The first US case has been detected.
There's confirmation the coronavirus has reached Australia.
The pandemic has also disturbed access to in-person mental health services. forcing many people to turn to teletherapy or go without help. The lasting effects of this pandemic on mental health are likely to be substantial and could lead to a mental health crisis. It's important for people to take care of their mental health and seek support if they need it.
In terms of physical health, the COVID-19 virus can cause severe respiratory illness and lead to hospitalization and death, especially in older adults and people with underlying health conditions. The pandemic has also disrupted access to routine healthcare, leading to a delay in diagnosis and treatment for other illnesses. The stress and anxiety caused by the pandemic can also weaken the immune system and lead to physical health problems. Furthermore, the pandemic has resulted in lifestyle changes such as prolonged periods of sitting at home, reduced physical activity, and changes in sleep patterns and eating habits, all of which can negatively impact physical health.
The COVID-19 pandemic has had profound impact on people's social lives. Physical distancing measures, travel restrictions, and lockdowns have resulted in widespread social isolation and loneliness, particularly among older individuals and people living alone. The closure of businesses, schools, and public spaces has disturbed people's usual routines and activities, leading to a decrease in social interaction and community engagement. The pandemic has also disturbed important life events such as weddings, graduations, and funerals, which are often social gatherings that bring people together.
The sudden shutdown of businesses, travel restriction, and physical distancing measures have led to widespread job losses and a sharp decline in economic activity. The crisis has affected different sectors of the economy differently, with industries such as hospitality, tourism, and retail being particularly hard hit. The pandemic has also highlighted existing inequalities in the labor market, with low-wage workers and those in the gig economy being more likely to lose their jobs or suffer reductions in their income.
The healthcare systems around the world were heavily impacted by this pandemic. The rapid spread of the virus has overwhelmed hospitals and put us at risk, leading to a shortage of personal protective equipment and medical supplies. The pandemic has also disturbed access to routine healthcare, leading to a decline in early detection and treatment of other illnesses. The focus on responding to the pandemic has diverted resources away from other areas of healthcare, such as preventive care, chronic disease management, and mental health services. Additionally, the pandemic has accelerated the shift towards virtual healthcare, which an increasing number of consultations and appointments are being conducted remotely. The lasting impact of the pandemic on healthcare is likely to be substantial and will require a sustained effort to rebuild and improve healthcare systems.
The pandemic also had a devastating impact on the restaurant industry. Physical distancing measures, travel restrictions, and lockdowns have led to a sharp decline in foot traffic and revenue. Many restaurants were forced to close their doors temporarily or permanently, resulting in widespread job losses and economic hardship for restaurant owners, employees, and suppliers. The shift to takeout and delivery services has been a lifeline for some restaurants, but these businesses have faced challenges such as increased operating costs and a decline in the quality of the dining experience. The pandemic has also accelerated the trend towards online ordering and delivery, leading to an increased competition and changing consumer behavior. The restaurant industry is likely to face long-term consequences as a result of the pandemic and will require significant support and innovation to recover.
In conclusion, the COVID-19 pandemic has been a global health crisis that had far-reaching impacts on our society. It has revealed many underlying inequalities and vulnerabilities in our systems and communities, and will require a sustained effort to rebuild and improve. It's important for individuals and communities to take care of their physical and mental health, seeking support if they need it, and follow public health care guidelines to help slow the spread of the virus. The pandemic has also highlighted the need for investment in healthcare, mental health, and economic systems that are better equipped to respond to future crises.
With this, I end the topic of COVID-19. I, Aglin Sirganisan, joined with
Muhammad Ahmed.
Hope that you take care and keep safe.
Keep safe.